Speech-language pathology. We're more than just words. Speech-language pathologists, SLPs, prevent, evaluate, diagnose, and treat patients from newborns to the oldest adults in 9 main areas. Speech affects how people articulate sounds and words. Language affects an individual's ability to understand and express spoken and/or written language. Hearing results in decreased auditory sensitivity, which affects speech and language development and overall communication. Swallowing affects a person's ability to chew and swallow foods and liquids. Voice and resonance affects a person's voice production. For example, a disordered voice might sound hoarse, too quiet, or too high-pitched, and someone with a resonance problem might have too much or too little nasality. Fluency gives the perception that someone's speech comes out stuttered or cluttered. AAC and communication modalities. This includes all forms of communication other than oral speech, such as computer aids and communication boards. Social communication affects social interaction, social cognition, and pragmatics, such as verbal and nonverbal language. Cognition affects a person's skills, including memory, attention, ability to identify time and place, and problem solving and reasoning. Within the healthcare system, SLPs work with doctors, nurses, audiologists, and other professionals, including rad techs, occupational therapists, physical therapists, respiratory therapists, physician's assistants, clinical laboratory scientists, pharmacists, and other professionals to improve the quality of life of the individuals they treat. SLPs can work for hospitals, a health system, in a client's home, or even for themselves in a private practice. According to 2011 data from the American Speech, Language, and Hearing Association, ASHA, 38% of certified speech-language pathologists are employed in healthcare settings. The most popular healthcare settings in which SLPs work are hospitals, skilled nursing facilities, and home health. SLPs are also often employed in schools and private practices. A bachelor's degree is required upon entering graduate school. Typically, students enter graduate programs with a bachelor's degree in communication disorders. Students must obtain a master's degree in speech-language pathology from a graduate program that has been accredited by the Council of Academic Programs in Audiology and Speech-Language Pathology. This is typically a 2-year program that includes both academic and clinical coursework and experience with a variety of populations. Following graduation, SLPs are also required to complete a 9-month paid clinical fellowship before becoming certified. During the clinical fellowship, future SLPs work under supervision. This is a necessary step before certification is obtained. SLPs are also required legally to be licensed by the state within which they work. According to ASHA, the demand for the field of speech-language pathology is expected to grow by 21% from 2014 to 2024. According to the U.S. Bureau of Labor Statistics, the employment rate of SLPs is expected to experience faster than average growth through the year 2020. The Bureau of Labor Statistics monitors the supply and demand for more than 700 occupations. According to the Bureau for Labor Statistics, more than 28,000 additional SLPs will be needed to fill the demand between 2010 and 2020. Reasons for this growth include an aging population. Older individuals are more likely to experience medical conditions that result in speech, language, and swallowing problems, an increase in early identification and diagnosis, increase in school enrollment, and an increase in the bilingual population. The greatest instrument for speech-language pathologists is their own perception. However, SLPs also use cutting-edge technology to evaluate, diagnose, and treat speech, language, and swallowing disorders. Some instruments used in the field include standardized and norm reference tests, computerized speech lab hardware, which is used to record acoustic speech data for a wide variety of quantitative analyses and biofeedback applications, VisiPitch, a specialized hardware and software suite that provides biofeedback and analysis of voice parameters such as pitch and amplitude, Nasometer, which can quantitatively detect and measure abnormal resonance, Stroboscopy, a visualization of the vocal folds and vocal fold vibration using a rigid or flexible telescope, and Modified Barium Swallow, a video X-ray of the swallow that pinpoints pathological swallow etiology. Within the given case study, the SLP will evaluate and potentially treat several areas. The SLP will be responsible for evaluating and treating swallowing disorders using bedside screening methods, followed by full instrumental evaluation methods using modified barium swallow procedures. Evaluation methods would identify the particular etiology and target treatment goals. Treatments could be of various types, including but not limited to exercise to restore strength, swallow maneuvers to change the physiology of the swallow, postures to make the swallow safer, and diet modification. The SLP will informally screen for hearing and make any necessary audiological referrals as needed. The SLP will administer an oral mech exam to evaluate the integrity of the structures and functions of the oral mechanism to determine if the muscles of the mouth, pharynx, larynx, and respiration are moving properly for speech production. In this patient, the SLP will be ruling out two main motor speech disorders that can occur given damage to the left hemisphere. These are unilateral upper motor neuron dysarthria and apraxia of speech. If the patient shows symptoms of groping, difficulty with longer words and sentences, inconsistent errors with generally intact execution, the patient likely presents with apraxia of speech. On the other hand, if the patient shows symptoms during the oral mech exam of unilateral weakness of the central lower face, lips, or tongue, strained vocal quality, mildly slow rate of speech, and mildly imprecise articulation, the patient may present with unilateral upper motor neuron dysarthria. Motor speech problems are treated according to the specific muscle groups affected in an attempt to restore their function. Overall, the SLP will focus on establishing the patient's ability to communicate effectively with his or her loved ones for as long as possible. Given this person's site of lesion, we might suspect that there could be some co-occurring aphasia, likely of a non-fluent type. Aphasia therapy would focus on restoring functional communication. We would also want to follow through with assessing this person's attention, memory, and visuospatial perception, although we might expect greater deficits in these areas given a right hemisphere lesion.